I really appreciate all the work that you do and the information you put out. And I think the last time we did a talk together was like over a year ago. And I feel like it should be more often. So
Yes.
I'm really glad you're here. Why don't you just tell everybody in the audience who's listening a little bit about you and where you're from, what you do, and all that. Give us the background of Dr. Daniel Chong.
Well, I just got off my bike, so just a little disheveled right now. But in Portland, Oregon, on a sunny day, and just dunked my phone in an old cup of coffee. So I'm hoping it doesn't die on me. Um, Other than that, doing well, and yeah, been here for practicing for 21 years as a licensed naturopath, and up until about almost a year and a half ago now, just trying to mind my own business and help people. And now I think my goals are the same. It's just been expanded to try to help people through this whole, whatever you want to call it.
Okay.
So,
Yeah.
and happy to be connected with you. I know we connected originally about more, I think, plant-based related things, which seems like a distant memory compared to everything that we end up talking about nowadays. So,
Yeah, I mean,
just
as passionate as we are both about that, like this has just become a more pressing thing that needs attention and needs resistance, and it needs and it needs people like you who are really doing. I think you're doing a really remarkable job to just provide the truth, as best you can discern it in the most unbiased way. Um, when
yeah.
so much there's so much floating out there that's just simply not true or biased or has an agenda.
Oh
And
yeah.
I think you're doing a really good job with that.
Thank you. It's not easy, and I find that kind of ironic because right now I'm in Facebook jail, um, and I will be for another 6 days. I just found out for posting information about peer-reviewed research. So on I don't even know if we're allowed to say the word, or you might get shut down. But there's a drug that rhymes with apple pectin um, that I'm a proponent of evaluating more and assessing its usefulness. And so I try to post a lot about it because there's a lot of interesting information out there from unbiased sources. And Facebook has decided they don't like that drug. And so me and a couple of people I know have been put into Facebook jail just for literally just linking to information that's talking about the actual studies on the drug itself. So it's a very interesting world, and it's a very challenging time to try to communicate important, relevant, legitimate information if it doesn't follow a very tight narrative. And I'll just say, sorry, I don't usually like to talk like that. Like I'm one of these glass half full people who likes to think that the whole world is just trying to help, people, the health world is just trying to help people be healthy and stuff. And I'm just having a harder and harder time uh, believing that because I just keep seeing more and more examples of how it's not just purely about the well-being of the public. So it's
Yeah.
weird times.
And just to put this out there for everybody watching, follow Dr. Chong on Instagram, and if you go to his bio, in the link tree, there's a link to his Telegram channel,
Yeah.
because it's only a matter of time before we just get booted off of all the traditional platforms. Like I'm hanging on, hanging on from the Facebook jail yet. I kind of just talk around everything. So
I have to say I'm shocked you aren't in Facebook jail. Yeah, I've seen some of your posts. I'm like, why isn't he getting in trouble?
and when
There's
people message me and they're like, "Hey, I just got out of Facebook jail," my number one thing I ask them was like, "Well, did you get any cool prison tattoos?"
right, right. It's so weird. And especially we're not saying anything crazy. But yeah. So yeah, I have this backup Telegram channel now. Just the other funny thing is the day I created it, I had not been put in Facebook jail yet. I was just like feeling a little weird, and I was like, I'm going to make a backup channel just in case. And I was just about to post about it, say, hey, go join my backup Telegram channel just in case. And then later that day, I get booted. So here we
So
are.
talk apple pectin. What information are you finding out about it?
I'm sorry, you cut out. Say that again.
Oh, I said let's talk about apple
Yeah, I cut that part.
word for something that rhymes with it.
Yeah.
Finding good information about how it has therapeutic properties, especially for a certain disease that's been rather prevalent in the past year and a half.
Yeah, I mean,
Run,
I would actually, sorry, I would actually say, from what I've learned, it's far beyond just this current issue that we're having. I found some research that was done at least 10 years ago, where, and I know I posted about this at some point, but they reviewed the efficacy of apple pectin, which is not act. I think people are getting it, against a variety of these types of organisms, and it was shocking to see the list. There are multiple of these organisms of concern that if it was proven effective, the whole world of health would change, especially with certain types of yearly injections that children and adults are supposed to get, because this drug has at least based on legit research that suggests high probability, but not, it hasn't been fully evaluated, but high probability that it's effective. It would essentially render those shots unnecessary, because it would be a clear, definitive treatment for those conditions. So why do you need a shot if you can just get a couple pills and be done with it? So
are we talking influenza then, or I mean, you say other
influenza, HIV, Ebola. I'll send you the list. You can post it. It's crazy. Like, and this is the thing. I heard about it from a medical doctor who's been practicing for 40 years, 45 years, and was like, neither I nor any of my colleagues, anybody I know that's been through medical school, has ever been taught that there's an effective drug out there for these types of conditions, like to prevent it or to treat it acutely. And why is that? Well, anybody who thinks rationally about it might consider the fact that there's I don't know, I'm the sort of person that I try to find ways to not think things like I'm thinking, like to prove anything I hear wrong or whatever, because I don't like to believe that there's nefarious activities going on. But if you have a drug that would make the majority, if not all, of these yearly shots unnecessary, that's a massive industry. And so some people suggest the possibility that this drug can't be shown to be that effective. It's just not possible. So, and it's playing out in a microcosmic way, I think, in this current viral arena.
Well, you definitely got to, once we get off the line here, definitely like repost that in the Telegram channel for everybody going to join in between now and then so they can see that.
Sure. Good idea.
Personally, I think it's hard to be sure whether there's like nefarious things going on, but I think that there's definitely obviously there's a financial interest, but I think there's also just like an intellectual kind of like prestige interest that like cancer weren't so complicated. Like that would invalidate a lot of people's work that they put in and things that they created, right. And time and research and all that, and a lot of people would lose a lot of prestige, and I think that's almost more at stake than like financial interests. Unfortunately, that's for a lot of these people that are doing research and that are physicians, professional prestige is like the number one priority. That's above money and that's above people's health. That's my personal opinion. Just having
Yeah,
known and worked in healthcare for a while, and went to a really elite school for undergrad where there was a lot of that kind of mentality of just like it's all about prestige.
right.
Uh, so I think that plays a factor. But yeah, it's pretty scary. So you're saying, well, let's talk about this compound. We're calling it apopectin, and I think people can infer what the real name is. But I believe it's like a natural occurring like plant derivative, or where does it come from?
I, I actually don't know that answer. I'm not 100% sure. I just know that it's very old and had 70 years or so. Uh, Last I heard, there's been well over a billion, if not 2 or 3 billion doses given. And in the world, it's commonly used for parasitic infections, especially in underdeveloped countries that have a lot of issues with that type of thing. Um, and the the creator of the drug won the Nobel Prize for creating this drug. Like it's that well recognized, it's that well established, um, and so the notion that it's dangerous to use in this situation, so the FDA is literally going to come out and say it's dangerous, or you put a post on Facebook and you get a little thing that says FDA has, or whoever CDC has said that it could be dangerous, is ridiculous. And then if you look at I even saw at some point some trial data, or sorry, no, there was the drug adverse drug side effect reporting system that I know we're all more familiar with than we ever used to be, probably. Um, if you look at the comparison of the use of this drug over however many years it's been, many years, multiple decades, there's been like less than 100 reports and like 2 deaths, and they were both in, I could be getting these numbers wrong, but they're minuscule, and they're only in people who are having specific die-off effect from a specific parasite. So there's this one type of parasite that is commonly used to treat, that if a person has a bad case of it and they take this drug, they can get very toxic effects from the die-off of the parasite. But if you take those out, it's basically like headaches and an upset stomach for a day or two, and that's it.
So we got a question in the chat, and I'll just kind of reiterate for people that are new on here. So we're talking about a drug that we're not going to say the name, but it rhymes with apopectin, and you probably have heard it talked about. You probably have seen it censored, and so we're talking about the safety and the efficacy. And just for people who are just hopping on, Dr. Chong here recently started a Telegram channel because he's been putting out a lot of information on this and other related topics in a very unbiased manner, but Facebook doesn't really like that, and a lot of these traditional platforms really don't like that. So we're kind of dancing around censorship here. But definitely click the link in his bio, and there's the Telegram channel. I think it's called Vital Human, and it's just all the information he's coming across. It's really solid stuff. So we're saying safety-wise, this stuff is like, it's like almost got a better safety profile than like Tylenol.
Way better, way better, like legitimately. And then there are some trials that have been done now for the current viral related issue this year, and I did a post a while back where I compared safety data and efficacy data between this drug and the shots that are being checked out, and it was like an astounding difference. Like, if you know anything about NNT, the number needed to treat, which is this metric that they evaluate for new drugs, where they're essentially, whatever drug in question, when they're originally evaluating it, they want to see how effective it is. So one of the ways to do that is to determine how many people need to take the dose of the drug to get the desired effect in one person. So a perfect NNT would be an NNT of 1, which would mean every person that takes the drug gets the desired effect. A high-level, good quality drug is considered to have an NNT of somewhere between 5 and 10. So 5 to 10 people have to take the drug to get one person to get the benefit. Um, Side note, statin drugs, which is where I know this more from, have NNTs in the range of 100 to 200. So 1 to 200 people have to take the drug for one person to not get a heart attack when they might have otherwise. Um, and so I did some analysis, partially with the help of some information I learned from a doctor named Reed Sheftall, who everybody should check out as well. He's got a YouTube channel called Truth in Science, and his last name is Sheftall, Reed Sheftall. But I dug into some of the data based on some of the stuff that he was saying, and I calculated the NNT for the shots, and they were somewhere in the range of 100 to 120. So that would mean that 100 to 120 people have to get a shot for one person to not get the symptoms of the condition that's been going around this year, who otherwise would have. So
I did the math on that based on the data I saw, and I came up with like 160. But
yeah,
I
it
mean,
might be that high. I can't remember the numbers, but it's over 100 people
yeah.
have to get a shot for one person to not get it that otherwise would have, which
And
is
so for apple pectin is what?
what based on a small trial. So admittedly a small trial, but the best data that we have was 11. So, more than 10 times as effective, just at least comparing these two trials. And, I'm the first to say, like, if out of 150 people that get a shot, you're saving one life, maybe it's worth 150 people getting a shot if the next person's life gets saved. But we're not talking about that. The trial data was showing that all it was showing that effective for was maybe giving them one less symptom. So like a headache, a sniffle, and a sore throat, then efficacy was based on, that the other person only got the headache and the sniffle. So you're potentially, especially depending on the person like you, who's a healthy guy, or all these younger people now that are having their, that are starting to get these treatments, these shots, these people have minuscule risk already. They might not, a large portion of them don't even know they have it when they have this health condition. And so we're asking them all to take this shot that has unknown and possibly known side effects that we can talk about, to potentially prevent something they wouldn't have even known if they had it in the first place. So it's all just blows my mind when I really think details about it.
So I don't want to put words in your mouth, but you're basically saying that if we used apple pectin as prophylaxis instead of these new emergency use authorization injections, that we probably would actually prevent more disease and morbidity and mortality.
I don't know that for sure. I just know that the research suggests that is a potential possibility. Yeah, I mean, and some experts out there, like legit experts on this treatment, Pierre Corey and the group called the Frontline COVID, FLCCC, Frontline COVID Critical Care. This is a worldwide group of doctors and scientists who are at the cutting edge of using this drug for this condition. And they would all say that, based on what I've heard them say, they would all say you take it and you won't get it. You take that apple pectin and you won't get it. I wouldn't come out and say that beyond just the suggestion of it, based on what the research shows. It's potentially highly effective. Highly effective for prophylaxis. And then the crazy thing is, they've also shown tremendous efficacy. Sorry, I'm just going to move here for a second. For early stage outpatient treatment, so somebody who's just homesick, all the way through to somebody who's hospitalized, it shows effective. So there's one thing that I think is inarguable is the range of efficacy from prevention through early treatment to middle to moderate to severe situations. One drug has this incredible potential, and Facebook won't even let you say the name on a post.
So
Weird.
let me do this. I have a question for you.
Yeah.
know that when we had last done a video together, we were talking about another drug that rhymes with boroquine
Yeah.
that was looking like it was pretty good, and now it sounds like apopectin's even better. But I remember at the time there were people doing studies, and they had created these studies that were really designed to fail. Where
Yes. Yeah.
study they overdosed them, or in the efficacy study they compared it against something like vitamin C instead of a real placebo, which was kind of suspicious.
Yeah.
And so, like, they were doctoring like alternative treatments to studies to fail, and then they were doctoring the drugs that they wanted, or the injections that they wanted to look maybe better than they actually were.
Yeah.
Like, especially we were talking about these, like, the gymnastics of, like, okay, well, reduce the symptom. Instead of a headache, a sniffle, and a cough, you just got a headache and a sniffle. So success, which is
Right.
kind of metric. What are some, like, walk us through what are the things that they're doing to make things less effective, like appear less effective or less safe than they actually maybe really are, and the things that they're doing to make the things that they want to look good look more safe and more effective than they actually are. Like, what are some of the gymnastics they do in the studies, or kind of trickery that
Yeah.
they pull to make things not appear as they may be?
Well, I mean, as far as this particular health condition, there isn't a lot of examples of those beyond what I talked about in that other video. Um, I have seen one study on vitamin C and zinc where trying to remember now. In that case, the setup was more the primary outcome that they were looking for was how long it took to get to a resolution of symptoms. So they weren't looking at, it's a super subjective assessment, and everybody in the study had a mild case, and so it's still, they still worked, so to speak. They still lessened the duration of the symptom, you know, the duration of symptoms, but it was small enough that they could say, um, no therapeutic effect, or however they put it. But the people had, I don't know how about you, but who normally has a cold for more than 12 days? Like, if they just put, if you have a mild cold, you're going to be over it pretty soon anyways. And so you'd have to take a massive amount of vitamin C, for example, to really speed that process up significantly. So I've seen studies like that. And then they did a similar study with this apopectin drug where,
Can I stop you for a second, because we got
sorry,
someone
yeah,
who's asking? I'm not confused about what apopectin is.
yeah.
The actual name starts with an I. I've something actin. That's close as we're going to get to you. Go
Yeah.
ahead.
And the reason for that is we don't want to get shut down. As I sit behind my Facebook bars in my Facebook jail. So yeah, they did a similar study. I saw a similar study design with that drug, where it showed a quicker elimination of the virus, like clearly a quicker elimination of the PCR positivity, but that wasn't the primary objective measurement. So they didn't really count that as whether or not it was effective. It was this whole symptom duration thing. And so if they select a bunch of healthy people who have a bunch of mild cases, you're not going to see a massive difference there anyways. So that's the extent of stuff I've seen with this particular situation. But, I know a lot about these food studies where they take somebody who has sky high cholesterol, or a group of people who have sky high cholesterol, and then they put them on an extra egg a week or 2 eggs a week, and nothing really noticeable happens, and they say, therefore, eggs don't raise cholesterol. And you're like, well, if you do that into somebody like you, your cholesterol levels would go up, no doubt. So it's all about these goalposts that they can move around with, and you have to dig into the study to really uh, identify what they're doing. But there's a wide variety of ways that they manipulate goalposts. So they're not actually lying. They're not actually being truly deceitful. in a way. Like they're not reporting false data or fudging the numbers. They're just making the goalposts in such a way that there's going to be a likely result from that. There's actually a really good discussion on YouTube on the Veg Source channel with Jeff Nelson, where he talks to Marion Nestle, who's this sort of renowned food science author and research scientist, and she's dug into the methods behind all of these big industry funded studies and everything like that. It's all about food in that case, but it's the same playbook, played out however you want, in whatever arena you're talking about.
Yeah, it's interesting you mentioned that because, I remember when I was in chiropractic school, I had a nutrition professor who was like, look, eggs don't raise cholesterol.
Yeah.
And okay, I know what study you're quoting, and I called her out in class, and I was like, look at how the study's designed, and they're just taking people who are already super high cholesterol and they're feeding an extra day. Like, don't you think this study was kind of kind of a setup? And then she backpedaled and was like, well, I got to do more research. But anyway, what's funny is that most of our colleagues, the other plant-based doctors, can see those kind of shenanigans a mile away. They're like, oh, not pulling the wool over my eyes.
Yeah.
But suddenly, when it comes to this, when it comes to, the current crisis and the experimental injections and the alternative therapies, it's like they're just getting duped by every little game that, that the industry's playing.
It's bizarre. It is bizarre. I mean, I don't know how else to put it, how I've seen so many examples of exactly that, where you have these super clear thinking, rational, logical people that that have to think that way in order to come to the conclusions they've come to about, nutrition, food, etc. And it's just like some type of weird blinder goes up, and every facet of what they use to get to those conclusions just goes out the window when they're evaluating this one particular situation. And there are some other people that don't, thankfully, but a vast majority. And again, I don't know how, again, from that perspective of I don't like to come to these conclusions early. I like to prove that what I'm hoping is wrong, or whatever. But over time, you can't, you end up left with no other explanation when you see such obvious corruption going on and different things like that, and yet people are still just towing the line. So you start to see these effects, these true effects of messaging, repeated messaging in the media, and repeated messaging from health, the health authorities, the TV doctors and scientists, just saying the same thing over and over and over again, and then, and beating people to within an inch of their mental health, and then dangling a carrot out in front of them and saying, well, you could do this, and then you're back in business. Who's not going to be like, okay, that's what we got to do. It's so, I mean, it's,
guys,
I hate it. Yeah.
So, and I just want to say, the criticality and the critical eye that you take with everything, I just want to say, I appreciate it so much. I know that I can always trust you to be completely unbiased. If there was ever a day when you were coming out and I thought that there was a bias to what you were saying, or you were overlooking clearly obvious facts, I would be pretty surprised. So I just want to say I appreciate that. I want to remind everyone watching, the Telegram channel is in his bio. Definitely go subscribe, because he's getting censored. And it's just got really good info. And I'm kind of bummed because I follow your Facebook posts, and now you're in Facebook jail getting your Facebook prison tattoos, and I got to go to Telegram to read your info. So we've got a lot in the chat.
I will. Sorry. Go ahead.
We've got a lot of people in the chat who are asking about what we'll call the experimental transfection injection.
Okay.
And so, unless you have other things to talk about with the eye drug, I'd like to move on and answer questions on that.
I'll just say my bottom line is, in all of this and all the work that I try to do around it, I don't mean to sound all overly humble or whatever, but I'm just a messenger. There are people out there that are doing the hard work and the brave work, and Definitely a group of those people is this FLCCC group on YouTube. They have a YouTube channel, Frontline COVID Critical Care, and then they have a website, COVID19criticalcare.com. They have, if anybody's interested in that medicine, that's where to go. They are the experts of the experts. They're combing the worldwide data that's being accumulated from people actually treating patients in the trenches and seeing what works and whatever. So I just would finish with that. Just go there if you want more info.
Okay, so my question for you is, this is something that I've seen people talk about a lot, and honestly, I'm not really a research guy. Like, I'm a clinician. Uh, I do not like. I used to have internships doing research when I was an undergrad. Hated it. I hate sifting through the literature. I just kind of focus. I stay in my lane. Like, I know how to get people well with fruits and vegetables, and I know how to adjust spines. Other than that, I let guys like you do this kind of stuff. But I've seen a lot of stuff about supposed shedding and issues with women's cycles, maybe of ones that didn't even get the injection. I'm seeing all of it as speculation and just kind of data floating around. Is there any specific evidence to show that to suggest happening? And if so, are they shedding the virus, or some excipient, or what the heck's going on?
So the first thing I'll say is you probably you may or may have not have noticed that I haven't posted anything about that. And the reason why is I haven't been able to find anything beyond anecdotes. And I'm the first person to say I never discount something that somebody's saying that they're experiencing, period. But if I'm trying to have a certain presence in Facebook and have people actually not write me off for being crazy or conspiratorial or whatever, I have to be cautious with what I do and don't post. So I haven't really posted anything about that, not because I don't believe it's possibly going on, but it's just because I haven't seen any actual data behind that. Now, that being said, there is clear signals in the data from people who get the shot having these issues. So the leap that needs to be taken sort of mentally is how mechanistically somebody could get the shot, develop these spikes, and then shed that into the environment in a way that another person could get exposed to that and have a similar effect happen in their body. I have seen some information that the spikes can end up in saliva, which if they could, that would provide a legitimate mechanism potentially that they could get out into the environment. It's a little, the thing that I have a hard time with is the virus, when it's out in the environment, it's wrapped in a lipid, and it's encasing, it's encased in something that's then allowing it, it to enter into the body and get into certain places in the body and do what it does. I don't know that just the spike made from somebody who got a shot is able to do that, but nonetheless, there's a lot of people that are saying this is going on. So something's going on. I don't know what it is, but I just don't have any mechanisms that would explain it, and I certainly don't have any data. The last thing I'll say is I have a tremendous amount of respect again for this guy, Dr. Corey, Pierre Corey, who's at the head of this frontline COVID care. And I was listening to one of his interviews where he was talking about the drug we were just talking about and how it's effective around the world and all this other stuff. And somebody chimed in and asked a question, essentially the same question. And I thought he was just going to write it off as, oh yeah, no, that's not going on. And he said he's had a number of his colleagues who he has tremendous respect for, these are the highest level, doctors and researchers out there, saying that they're seeing this. So, and he said, but that's all I'm going to say, because I don't know anything more. And so I don't know. It's one of these things where I would never again deny that people are experiencing this. I just can't come up with a legitimate enough explanation or legitimate enough proof or data to be able to like say anything certain about it.
Well, I appreciate you being forthright about that. I haven't really talked about it either, for the same reasons, but I'm really not keeping up with the research like you are. So, yeah, I really appreciate you giving an honest answer on that. And, hopefully
I,
it'll be
I
some.
will, yeah, I want to say one other thing. A lot of the research that's out there that has made me very concerned about these shots is it's research that is looking at the effects of the virus in people and what it's doing to this or that tissue or this or that organ or an endothelial, inside lining the blood vessels, or the potential that there is for autoimmune processes being sort of started by exposing themselves to this. But the interesting, fascinating thing is the majority of these studies that you see that are bringing up these very legit concerns, like observations of what are happening to people when they get infected, they oftentimes are specifically talking about the spike. So they're saying the virus, but they're saying that the impact, the sort of like fine-tuned, like baseline impact of what's actually causing the problem in these people who are getting these problems when they're getting infected is the spike by itself. And they've even done some research where they've injected just the spike into mice, and they're seeing these effects. So any logical person might be able to make the very small step from, well, if the spike is causing the problem in these people, and then we get their cells to make that exact spike, isn't it just logical that it could theoretically cause similar problems, in these other people that are getting these shots? And then fascinatingly, we're seeing reports coming into VAERS, people getting similar reactions that some people get when they have a severe case of COVID. So like, there's so much overlap, and there's a clear mechanism as to why, and yet there's this like line in the sand that you can't say this causes it, even though this is clearly causing it, and they're technically talking about the same thing. It's very strange,
So, hey, we got a comment. People want to see that mouse study you're referring to, so maybe fire that off in the Telegram. And,
Sure thing.
this is yeah, fascinating stuff. I want to open it up for Q&A for
Sure.
anybody listening. If you got questions, please ask. Okay, so we have, someone says Moderna has never made a vaccine before, and Pfizer is a criminal company. I mean, I'll answer this one. Yeah, it's a new company. This whole mRNA thing is a new technology.
Well, Moderna started out trying to make the same technology for cancer, and they failed. And all of a sudden they pivoted, and now they're making boatloads of money doing it for this instead. For whatever, however you want to take that.
The name literally means modified RNA. Like, that's where it comes from.
Right.
So that's what they're trying to do. And, they tried it in one application, it didn't work. They tried it in something else. I mean, this is technology, this is industry, this is business. That's no surprise. Yeah, and Pfizer doesn't have a good track record, but neither does Merck, neither does GlaxoSmithKline, neither do any of these guys. And then get me started on like, what is it, Purdue, the guys who make OxyContin. I mean, it's bad times.
Yeah, I mean, I find it fascinating that Pfizer's been, tagged with the largest fine in history, and they're convicted felons, and the crime they were convicted of was literally lying to the public about the efficacy and safety of one of their drugs, which there's no possible way it stood to make anywhere close to as much money as this one's going to make them. But I'm sure they've changed all of their ways of doing things now that they have a chance to be like, paid beyond imagination.
Yeah,
I'm a little skeptical.
That's the ultimate conspiracy theory that somehow organizations and companies that just break the law and lie to people and harm people and don't care who they step on to make their money. Suddenly, when all the money's on the table and they have no liability, they're going to start playing by the.
Oh yeah, that don't forget that the no liability part too. Yeah, that would make anybody tighten everything up. Right.
Yeah. So for you guys who are listening and maybe you don't know, um, so normally if something like a statin drug or a blood pressure pill or a an SSRI like depression drug harms you, you can sue the manufacturer. But with vaccines, under what's called the National Vaccine Child Injury Act and under what's called the PrEP Act, you can't sue them if you have an adverse event.
Yeah.
People don't even know this.
Yeah.
So, like, literally, they have no financial incentive to make the drug safe. They can just say, "Oops, sorry."
Exactly right. And it sounds like that couldn't be possibly true, but it's absolutely true. And I remember reading early on that even in the there is a vaccine injury court, and people do get reimbursed, so to speak, for damages, but it's paid by the government, which means it's paid by us. But the process that they have to go through is not easy. And I do also remember seeing that as these new shots were being prepped, they actually have made some additional hoops that you have to jump through to make it even more challenging. And I also follow this guy on Twitter. You might be familiar with him, Alex Berenson. He's like a former New York Times investigative journalist, and he's like all over all this stuff. And he's found all kinds of things that are related to that in these and he's actually in the midst of get backlog that's currently present in the vaccine adverse event reporting system. Apparently, there's a massive backlog of reports that haven't been processed and haven't been posted yet. And I don't know about you, but I'm concerned with the ones that are posted already. And apparently, there's a huge backlog. And I just and now we got the teenagers, lining up, and it's just it's concerning.
So let's talk a little bit about VAERS. I think that's an important subject. So we got the vaccine adverse event reporting system, which most people hadn't heard of this year, right?
Yeah.
So basically, when someone gets injured by a vaccine, they report to the system whether or not they have any certainty of whether the vaccine actually caused it. They're supposed to put it in there just to be safe. Before this whole crisis, research was estimating that 1% of injuries were actually reported to the system. And now you're saying, okay, well, now there's like way more injuries in the past year than there's been in many years reported to the system. And you just told me that there's so many that they have a backlog that the database isn't even up to date. And I know that there's also another reporting system called vSafe that the CDC started. There's like multiple kind of collections of data around this. It seems like it's really disorganized. Can you kind of give me the latest around like what's going on with injury reporting?
So I've only heard a tiny bit about the vSafe thing. I don't know anything about that. I do know that Europe has their own reporting system, and that the people that I've talked to who have evaluated that say that there's like a significantly higher amount that's been reported in the European system than the U.S. system, and the suspicion is that there's this massive backlog in the U.S. system. But I don't know about the other one, the vSafe thing. But one, to just touch on something that you said, just so people who don't know this already have a real good understanding of the relative difference that we're talking about here in terms of reports for this particular shot versus what's typically reported, which is, again, scary enough as it is. There's been over $4 billion paid out in vaccine injury court in the last 15 plus years or so. So there's a significant amount of stuff being reported. But I looked at a research study that evaluated all deaths reported into the VAERS system between 1997 and 2013. And for all shots, all vaccines given to all ages for whatever that is, I can't remember. I'm not doing the math. 1997 to 2013, I think it was. Um, so in 16 years. So they're doing that, and the deaths reported in that system during that entire time were somewhere in the neighborhood of 2,000 in a 16-year period. And we're now December, January, February, March, April, 5 months into this shot, and there's over 3,500 reports. So 1,500 more reports in 5 months versus 16 years. And like, I'm just completely baffled at the thought that people can still write all of those off as probably coincidental, would have happened anyways in this population, all these little excuses that you see people make, even though you're having these reports happen in young people, totally healthy. I just read a report the other day, 16-year-old girl, no prior health conditions, bilateral pulmonary embolism, reported and died, and reported in the VAERS system after one of these shots, and it wasn't the Johnson & Johnson. So, it just like how somebody can just write that off as like, oh, probably would have happened anyways. How one of you, I don't know if you, I've never heard of a bilateral pulmonary embolism in somebody who had no prior health history issues and they even tested for clotting disorders in that person, and there was none. So,
Wow.
to me, like, that should be dug into, and it's like nobody knows any of this is going on unless you look yourself, and it's just messed up.
Well, it's fascinating you mentioned that it just gets written. Well, it definitely could have been the vaccine, right? Because I remember back like a year ago when they were saying, oh, there's all deaths and blah blah blah, and then we're looking at the data, and people have all these comorbidities, and they're really old, and they've got heart disease, and they've got diabetes, and they've got dementia or whatever, like 2.6 comorbidities on average. And we say, well, did they really die of the virus, or did they were going to die of the comorbidities that kill everybody? And we got so much blowback, like, oh, how could you say that? That's a life, blah blah blah. It was the virus.
Exactly.
But then the same thing happens where we go, hey, maybe perfectly healthy person just croaks, 16-year-old kid croaks after the shot. Oh, definitely coincidence.
Yep.
It's like the double standard is just astounding.
It's out of control. I mean, literally, in one case, you're looking for every reason to say it was caused by the bug. And in the other case, you're looking for every reason to say it wasn't. And it's like literally insulting. Like, it doesn't take a doctor, a scientist, somebody medically trained to look at some of these and just be like, wait, what? Like, how is that possibly? I've read the, reports on, like, in the news, died fifth, or in a newspaper, article, died within the 15-minute observation period, directly, like, collapses on the floor and dies. No, like, it's just, I don't get it. Hey, you know what? I'm going to plug my phone in here, so I'm going to unplug my headphone.
Okay. Well, we're pretty much
getting close.
Time here. We got a bunch of good questions.
Yeah.
I want to remind people to join your Telegram channel. That's where everything's moving for you, because Facebook has imprisoned you, at least temporarily.
I will say, sorry, I'm going to keep trying to use Facebook. Is such a great, I hate it, but it's a great way to communicate, as I know you know. So I'm gonna play within the rules and use certain ways of communicating more smartly than I thought I needed to be when I just mentioned that drug's name. Like, literally nothing conspiratorial at all. So I'll probably be doing a combination of, like, sometimes you're going to see Facebook posts from me that say, go read my Telegram post so I can talk more bluntly about this or whatever, but I have enough followers on Facebook that I think there's important stuff out there, and I don't want anybody to miss it. So, and that's just Daniel Chong on Facebook, and anybody can send me a message request and or friend request or whatever, and I'll be on there too, but I won't be on there for the next 6 days because I'm still in jail. So Telegram for sure will be active, and then I'll probably just post similar stuff.
All right, awesome. Well, hey, thanks for your time. I really, really appreciate you and all the work you're doing. I'm gonna, after this is over, I'm gonna swizzle it and make like a Facebooky version and a YouTube version so we can post it there too and
Thank you.
spread the word. But yeah, I just want to say thanks for coming on and thanks for doing this and thanks for continuing to put the information out there. You're doing awesome work.
Yeah, thank you. I'll say the same about you, and glad we connected, and happy to talk anytime.
All right. Bye, Dan.
Cool, man. See you later.